never felt like this going into a competition before, and I tried to go out here and have fun, and warm up in the back went a little bit better, but then once I came out here, I was like, no, mental is not there, so I just need to let the girls do it and focus on myself.
That's American Olympian Simone Biles. Her candid and revealing remarks about her mental health are being held up as an example for us all. Biles, four-time Olympic gold medalist and considered one of the greatest gymnasts of all time, posted on social media that she sometimes feels as if she has the weight of the world on her shoulders. She's now pulling out of another event at the Tokyo Games. Biles has pulled out of the team event yesterday at this time, and overnight, we learned that she's withdrawing from this week's overall individual competition, too. She could return for event finals next week. Our next guest is following all this very closely. Dr. Katy Kamkar is a clinical psychologist at the Center for Addiction and Mental Health and an assistant professor at the Department of Psychiatry at the University of Toronto. She's also a medical practitioner for the 2017 Invictus Games, where she worked closely with athletes who were service members and veterans. And we reached her in Toronto. Doctor, thank you so much for your time.
Thank you so much for having me.
So Simone Biles withdrew from the all-round competition to focus on her mental health. Obviously, you're not in a position to diagnose from a distance like this, but can you talk about your reaction when you heard she did what she did and why she did it?
Well, first of all, we do know that 1 in 5 individuals are impacted by mental health problems, certainly by the age of 40. Here we are talking about 1 out of 2 individuals. And this, again, should not be surprising, just as everyone, either directly or indirectly, is impacted by physical health problems. Same goes for mental health problems. And here with athletes, despite being physically active and fit and healthy, they can struggle just as anyone else from mental health problems. And certainly we do know that the emphasis at times on being physically fit and mentally fit can at times again further perpetuate the sense of isolation and the suffering in silence. And we also know that athletes, just as again anyone else, go through daily challenges, significant life events, but there are also some stressors that are inherent in the world of sport.
So let's talk about those stressors, because the USA Gymnastics say they've supported her decision, saying that she's being courageous and that she's a role model for so many. And yet, as you say, this is a situation where there is media attention, there is social media attention. This is a whole career that she has, that she's built on her abilities as an athlete. Do you think that there is enough support out there in sports in general, by associations and maybe even by media and the community of other athletes, for the athletes themselves when it comes to mental health?
Well, first of all, even when we talk about stressors inherent in the world of sport, the diverse stressors, but just to name a few we are very familiar with, can be the intense training and preparation, pain and physical injuries. So again, always appreciating as well the comorbidities among mental health conditions and also the mental health and physical health conditions. The fear and concern about letting others down, the concern about poor performance, the fear and anxiety about not maybe meeting one's goals and expectations. There's as well a tendency to measure sense of self and who we are and identity and our role based on outcomes. And of course, if the outcomes are not positive, it can lead to a sense of failure, feelings of worthlessness, and at times not being able to engage in activities or events, again, because of the intense training and preparation, or at times because of exhaustion, pain, and physical injuries. We do know that social support has always been found, and this is true for anyone in anything that we do, has always been found throughout research to be one of our strongest and best protective factor towards healing, towards seeking help, seeking support for mental health promotion, prevention, and early intervention, and also for healing and recovery. Any type of support, any type of that we know we are not alone, that we are being heard, that we are being listened to, that there is empathy need, there is genuine care, it can definitely be such a positive factor and very much help us to boost against, to further boost resiliency and being able to seek help and being able to bounce back from any, again, life adversities and setbacks. So certainly the more we are able to have the conversation ongoing, it helps to reduce stigma, but it also helps to change everyone's attitudes. So to ensure, again, everyone has a better understanding and appreciation for the entire concept of mental health, because again, health is health, whether we are talking about mental health or physical health. There is always a mind-body connection.
Biles, the latest elite athlete to publicly prioritize mental health. We saw Naomi Osaka, who's also been very open about her struggles with mental health in the lead up to the games, in which she did not medal and was out very early in the competition. I understand what you're saying about having the conversation and about public awareness, obviously very important and much more important than it was even a few years ago. But what does it say to people who get into sport for the love of sport, for the celebration of athletics, and presumably hoping to build that mind-body connection, and yet they're having all this difficulty? What's gone wrong?
I think that, again, it's a very much, it has always been also the case. We know in the world of sport, health is important. But here it is really also putting into highlight that health is physical health, but it is also mental health. And the appreciation of the whole person management approach, of the holistic approach to care that are very important. And I think that this here is very much the highlight. Also, the more we are having the conversations and a conversation going and further education and mental health promotion, it helps to reduce what we call self-stigma. And self-stigma can be very paralyzing. So stigma is when we start evaluating our own mental health conditions or engage in negative self-labeling, putting ourselves down. But self-stigma also comes when we internalize other people's attitudes towards ourselves. So whenever we are able to see a lot of support, a lot of care, focusing on mental health promotion, all of those ingredients help to further reduce self-stigma. So this is something that, same thing again, the same approach for medical health, physical health problems. We want to, again, adopt this holistic approach when it comes to our mental health.
Well, with any luck, that the awareness that these young women are bringing to this will be not only in athletics, but in the rest of our society as well. But Dr. Kamkar, I want to thank you so much for your time. Really appreciate it.
Thank you so much.
Dr. Katy Kamkar is a clinical psychologist at the Center for Addiction and Mental Health and assistant professor in the Department of Psychiatry at the University of Toronto.